We thank you all for joining us today to talk about an important topic relevant to all within the clinical and non-clinical realms, understanding and addressing the impact of gambling disorders, particularly in the context of workplace wellness. It is my pleasure to introduce Ms. Kristen Beal, currently serving as the clinical manager at the Maryland Center of Excellence on Problem Gambling. Kristen plays a crucial role in supporting healthcare providers and certified peer recovery specialists in addressing gambling-related harms. With over 19 years of experience in behavioral health, her work involves offering clinical consultation to healthcare providers, helping them to integrate therapeutic gambling conversations into their treatment practices. Kristen's dedication extends to supporting certified peer recovery specialists in their efforts to assist individuals impacted by gambling-related harms. Additionally, she provides clinical training to healthcare providers across Maryland, aiming to increase awareness of gambling addiction within the healthcare community. Kristen's passions for working with those affected by gambling-related harms is evident in these commitments and to education and advocacy. Today, as we delve into the important topic of gambling in the workplace, Kristen's expertise promises to provide valuable insights and guidance. Kristen earned her master's degree in social work from the University of Maryland, Baltimore School of Social Work, and maintains an LCSWC with the Board of Social Work Examiners, an ICGCI with the International Gambling Counselor Certification Board, as well as a CACAD with the Board of Professional Counselors and Therapists. Please join me in welcoming Ms. Kristen Beal.
Thank you so much, Alice, for that introduction and for allowing this presentation today. So just a little bit about the Center of Excellence on Problem Gambling. Our role, or our mission rather, at the center is to promote healthy and informed choices regarding gambling. So we do that through various initiatives and partnerships throughout the state of Maryland. We really don't take a stance on gambling. We want people to, if they choose to engage in gambling, to make healthy and informed choices when they do, and to make people aware that there's help and hope available if they find themselves having a problem. So again, a part of our resources and initiatives is really public awareness. It is Problem Gambling Awareness Month, so we hope that you'll be seeing some of our radio ads, hearing some of this more this month, maybe on the TV as well. We also have a prevention manager who works with the youth, elderly, and everybody in between on preventing gambling. We also have a government relations manager who has her pulse on the public policy as it relates to gambling in Maryland. We are currently advocating against the gambling expansion of iGaming and iLottery. We also have a research department, and I'll speak a little bit about the research, the prevalence study that was done. The center offers free clinical training on gambling-related topics throughout the year that culminate with our annual conference in June. So save the date, it'll be June 14th at Turf Valley, and all of our trainings are free with CEUs. We also have a directory of over 100 providers that offer no-cost treatment to Maryland residents that are impacted by harms associated with gambling. And that is not just for the gamblers, but for their family members as well. As mentioned, we also have peer recovery specialists that have lived experience with gambling addiction and recovery. They cover the state of Maryland and work to connect persons to no-cost treatment, GA meetings, smart recovery, credit counseling, whatever they might need to help them in their recovery from gambling disorder. And we also manage the helpline, 1-800-GAMBLER, which is now also the national helpline. So persons calling that helpline can get connected directly to no-cost treatment providers, or even warm transferred to one of our peer specialists. So today, I just want you to understand the impact of gambling disorder in Maryland and how it could impact workplace wellness, recognizing some of the signs and symptoms of a gambling disorder to understand when somebody might be at risk, and some evidence-based screening tools that you could integrate into your practice, and as well as the resources that are available. So again, it is Problem Gambling Awareness Month. So this year's tagline is "Every Story Matters," and it's just a reminder that every narrative, battle, and triumph related to problem gambling is significant. So really, I like to start out with the definition of gambling. So what is gambling? It's the act of risking something of value, including money or property, on an activity that has an uncertain outcome. That's the definition that we usually generally use. But Gamblers Anonymous actually says any betting or wagering for self or others. So even if you're making a bet for somebody else, whether it's for money or not, and no matter how slight or insignificant, the outcome is uncertain or depends on chance skill that constitutes gambling. So Gamblers Anonymous goes so far as to say whether it's even for money or not, whether you're wagering for yourself or others. But again, the outcome is uncertain, and that's kind of the underlying similarity when you look at the definition of gambling. Some examples of gambling. Bingo, raffles. Just speaking about raffles that are sometimes done at schools or churches in attempts for fundraising. We know sports betting, lottery is the primary means of gambling in Maryland, as it is not. Well, with sports betting being mobile, I will say that that's more accessible. But before that came online, lottery is available in grocery stores, convenience stores, and at gas stations. Any game, so played for money, cryptocurrency or the stock market, day trading is kind of what we think about with that. Fantasy sports, loot boxes, so any type of social gaming or esports. So why might people choose to gamble? Well, it's exciting, right? There's usually a lot of bells and whistles going on. Maybe there's other form of entertainment that coincides with gambling. It's also opportunity, right, to win money. You're risking something of value in the hopes of winning something in return. But people might also gamble to escape, to forget about their problems or relieve stress, similar to the way that people might use drugs or alcohol. And then ego. So we think a lot of times about like poker or maybe spades, any type of card game, right? There's a lot of pride and bragging rights when it goes along with that. And then also, if people are gambling in the casino, sometimes people might crowd around and cheer that person on. And so that can kind of feed your ego as well. So gambling is really similar to some other legalized substances like alcohol or nicotine, maybe even now marijuana. It's a recreational activity that many people can enjoy since it is legal. There are age restrictions limiting use by minors. So the lowest age to engage in gambling is 18. Opportunities to gamble are numerous and widely promoted. So we see a lot of the quote unquote free betting being offered or billboards with mega millions and things. And so it's very widely promoted. And I've often seen the billboards as well as with alcohol co-occurring with that. So a little bit about the scope of gambling and what that looks like. So in the United States, it's legal in 48 states in some capacity, and Utah and Hawaii are the only ones that have a ban on it. However, Hawaii does allow games in private residencies. Um, it's a estimated $130 billion industry. I will say that I wonder if there's some other unregulated types of games that might be gambling. For instance, I do play games on my phone and I see some advertising for like bingo that can be connected to your Cash App, and other games like that. So what are the costs of gambling? So the National Council estimates that it's about a $7 billion societal cost. And these costs include crime or incarceration, um, medical or mental health access, or maybe accessing maybe more emergency room visits, recurring treatment attempts, loss of productivity. So we'll talk about that when it comes to workplace as well. Unpaid debts and taxes, foreclosures. It can lead to homelessness, divorce, and suicide. Gambling actually has the highest risk of suicide of all the addictive disorders. So why screen for gambling? Well, a little bit about what we mentioned, and then 85% of adults have gambled at least once in their lifetime, 60% in the past year. About 6% of college students struggle with gambling related problems, and that might increase, right? With the sports betting, we might see that number change. as more people maybe engage in that activity. And those with alcohol use disorders are actually 23 times more likely to develop a problem related to gambling. Nationally, it's really small. About 1% of the population has an identified gambling disorder. Again, with the expansion, this could change. But another 3 to 6% indicates that gambling is negatively impacting their life. And that could be the loved ones, right? Because gambling disorder affects about 7 to 10 people in the person's immediate circle. So that's, their loved ones, their family, friends, and then even employers. Just a little bit about the prevalence study. As I mentioned, we have a research department. So what's changed? They've done this prevalence study, I believe 2017, 2020, and 22. It might even have, I have 2010 data as well in here. And so some of the stuff has changed, right? Was during pandemic, some of this research was done during that. Younger adults are kind of underrepresented, and they're really also, again, not looking at persons under 18. So we really don't know how youth are impacted. Also, this survey was done before mobile betting was available. So the trends, again, ever gambled in lifetime, nationally about 85% of the population. So that's kind of on par with Maryland as we see the trend. It's about 90% in the 2022. Ever gambled in lifetime, just, ever done it. Then they break it down as well as to identify who might be an at risk or even a disordered gambler. Um, about 80% are very low risk, and they use the nods to look at identifying whether or not somebody is a disordered gambler. And they lump that in. So anybody that scored a 3 or above is classified into that disordered gambler category. And looking at disordered gamblers using that nods over the years, we did see an increase in 2020, but you kind of see it's kind of on par, maybe about 4% are disordered gamblers in 2022. And then we look at age. I kind of did it by color a little bit, just because to make it kind of stand out. We see a high number of 35 to 44-year-olds, but 25 to 50 to 64 are on the higher end. And then when it comes to gambling, men tend to gamble at a higher rate than women, but it doesn't mean that women aren't at risk of developing problems related to gambling as well. And then this is about 9.6% of males are at risk and 6.8 are identified as disordered, and 6% of females and 2.6 are disordered. Again, they did look at sports wagering, even though it wasn't legal on mobile. It was legal in brick and mortar. And then we also know there is still illegal gambling or overseas sports wagering that might still be found, that people might still be engaging in. And again, just kind of highlighting in years, 35 to 54 had the highest percentage, but again, 25 to 64 are at that higher end. Again, looking at those who wagered on sports, about 50% had done so in the past year, and only 12% had done so on an online or mobile platform. It did find that with the sports betting online, they had the highest risk of developing or having a gambling disorder. And the National Council on Problem Gambling actually has found that to be true. They saw they expect gambling addiction to grow by 30%, and they did see an increase in helpline calls, a 45% increase in helpline calls between 21 and 22. So again, the expansion of sports betting is happening across the nation, state by state. So some of the risk factors of developing a problem with gambling, again, men, right? They're just generally more likely to be risk takers, I will say that. So that's, kind of why we see that, is that they're just more likely to take risks. Women who develop problems gambling tend to do so a little bit later in life and then the progression of the disease happens a little quicker. But having gambled under the legal age or having an early start and maybe even a big win can put you at greater risk. Having adverse childhood events or experiencing trauma, mistaken beliefs about the odds, or a history of risk taking or impulsive behavior. That's actually why we see a lot of times our first responders or military persons developing problems related to gambling. It's risky. It's kind of on the edge, right? Having a family history of this, living in a disadvantaged neighborhood, or near or working at a casino or other gambling venue can put you at greater risk. So a little bit about the progression of gambling disorder and some of the warning signs. So the history, I always like to say that the people in recovery kind of know more than the professionals, right? And this is evidenced by Gamblers Anonymous being created in 1957, and then the American Psychiatric Association not even recognizing it was a disorder until 1980, when it was introduced into the third edition of the DSM and remained under impulse control disorders and classified or called pathological gambling in the DSM-4. But in 2013, with the DSM-5, they recognize that gambling disorder is very similar to substances and have reclassified substance-related and addictive disorders. And so currently, it's the only behavioral addiction in this classification. A big reason for that is because of the brain, right? We'll talk about some of the signs and symptoms, but right? The pleasure center, that limbic system, dopamine is being released when people are gambling, even though they're not putting something into their body, right? They're still having this brain activation. And so you can see in the picture that it's really highlighted during the win, but even the near miss, there's some brain activity in that reward system. And if you think of a near miss, I kind of give the example of like a slot machine where it's like a 7, 7, and a cherry, right? The brain is like, oh, I was so close. Let's just one more time. So when it comes to the diagnostic criteria, I'm going to also refer to this as the warning signs. But it's a clinically significant impairment or distress, exhibiting four or more of the nine criteria over a 12-month period, and not better explained by a manic episode. So you want to rule out that this is that people are gambling in a state of mania. It could be episodic or persistent. So thinking of episodic, if a person maybe only bets on football and that's it, and maybe they meet the criteria for gambling disorder during that time. So some of the signs and symptoms, lying to conceal the extent or involvement with gambling. So some of our research has shown that people spend maybe 6+ hours in a casino or gambling venue, and they may not be sharing where they were actually at that whole time. Or maybe lying to conceal how much money they've lost, which of course can jeopardize our relationships, right, with our spouse, our friends, or even our employers. Maybe we're not showing up on time or missing deadlines because of our involvement with gambling. Maybe we're asking coworkers to borrow money to get us out of a financial situation. Maybe they can't afford lunch every day, or their parking, for instance. And they might be preoccupied with gambling. So thinking about the odds, if the stock market, what's happening with that, what are the trends with the sports, who's injured, who's not, being preoccupied, maybe thinking about how am I going to get money to gamble again as well. We also see signs of tolerance and withdrawal when it comes to gambling. So a person might start out with the $5 bets or maybe $5 scratch offs, and that's getting those juices going, that reward center, pleasure center activated. But then it's not as exciting anymore. So let's put $20 down or buy $20 scratch offs. They have those big scratch offs that cost more and more money. And that's a sign of tolerance. But people also experience withdrawal and become irritable or restless when they're unable to gamble. They might make repeated unsuccessful attempts to try to cut back or control their gambling. And then gambling when feeling distressed, as I mentioned earlier, like that escape, to kind of get away, to not think about the problems. Um, and then also chasing money. So after, they lost that $500, oh, I got to get back and get even. I got to get that money back. So you want to specify, it's the same as other substance related and addictive disorders, remission, or sustained remission. And the criteria for mild, moderate, or severe, right? It's the same. So 4 to 5 is mild, 6 to 7 is moderate, and then 8 to 9 is severe. But I want to consider that maybe 1 to 3 of that criteria is maybe that at-risk population, those that might be, maybe tipping into that mild criteria. So we see a lot of similarities, right? Not only the brain activity, right, but that preoccupation, tolerance, withdrawal, loss of control, other developing other biopsychosocial disorders, lying to conceal the behavior, a negative impact, right? It impacts the family. Other ones are concerned about us. And then self-help support groups, right? So there's also 12-step meetings, Gamblers Anonymous. But there are some differences, right? It's a lot easier to hide. You're not putting anything into your body, so there's nothing to smell on your breath. There's no marks to see. There's no ingestion required. So therefore, there's no risk of overdose, right? I will say it doesn't mean that people aren't falling asleep at the table or maybe not taking their medicines that's prescribed, maybe not going to the bathroom when they're supposed to, afraid to leave the table. Um, I was recently speaking about this with a friend and just, they don't really set limits, right, on how much you can gamble with. There's some states might say it's a $5 million a day limit, which is really extreme, right? Who can spend $5 million a day? Is nobody I know. But you couldn't put that into your body. There's no way that you could ever, there would be a risk of overdose if you were to put that amount of money into your body. So it's not limiting, right? There's no way to kind of self-limit when it comes to gambling because you're not feeling, overly intoxicated or anything like that. It's just kind of keep going. The high is still there. There's a lot more fantasies of success. Um, the average person who gambles, doesn't have a problem, believes that they're going to lose that $20. I'm walking into this casino expecting to lose it, whereas persons with a gambling disorder are believing they're going to turn that $20 into a mortgage payment or, into millions of dollars and just believe that they'll be able to walk away. There's also a lot less resources available when it comes to gambling disorder. The stigma for substance use is getting better. It's being reduced, but when it comes to gambling, there's not as much resources available. I will say there's only 16 in-person meetings in Maryland for Gamblers Anonymous. Whereas if you looked up an Alcoholics Anonymous meeting, you really probably got to narrow it down by county to get probably 20 meetings. There's more shame and guilt, because there's a lot more greater financial problems, and people don't really talk about money. They don't talk about, their struggles to pay bills and things like that. And because of that, there could be a lot more anger when it comes to the family. You know, why aren't these bills getting paid? Um, More denial and defenses because you don't want to talk about money. And then a lot more, or I'm sorry, a lot less public awareness and acceptance that this is a problem because, hey, you're not putting anything into your body. Why can't you just stop? Not realizing that it's an addictive disorder, just like substances, and people cannot just stop. They need help. And then when it comes to co-occurring disorders, there's a lot of comorbidity. And SAMHSA recognizes that 9.2 million adults in the United States has a co-occurring disorder. And I love this quote. It is rare to observe a disordered gambler without a comorbid condition, and it is often that comorbid condition that ultimately leads the individual to treatment. So again, you might actually already be working with persons that are struggling with gambling. Some of the common comorbidities are other substance-related and addictive disorders. As I mentioned earlier, alcohol use is often comorbid. Affect disorders like depression, personality disorders, usually cluster B, ADHD, anxiety, or other stress-related disorders as well. And as I mentioned, gambling has the highest rate of suicide. According to the DSM, about 50% of those that have an identified gambling disorder have contemplated suicide, and about 17 to 20 have made an attempt. Oftentimes, again, that financial devastation, right? If they might be thinking, I'm worth more dead than alive. My family will be able to collect this insurance and be able to make whole again from all the financial devastation that I've caused. Research has actually also found that depression was a significant predictor of suicide death in those that have comorbidity of gambling disorder. And again, it's understudied and under-recognized. People understand the lethality when it comes to substance use or other mental health disorders, but don't recognize that gambling can be just as life-threatening. So again, gamblers, they may not ever seek treatment. About 7 to 12% of those with a gambling disorder have ever sought treatment. And a lot of evidence suggests that those that have more severe gambling symptoms um, and that may be more likely present with other comorbid conditions are those that are the ones seeking treatment. So again, that's really why it's important to screen for gambling. March 12th, last Tuesday, was Gambling Disorder Screening Day, National Screening Day. And it can really help identify individuals who might need further assessment. Those who are maybe impacted financially, uh, maybe they're not the ones with the gambling problem, but they have a loved one that has a gambling disorder, or they're struggling with thoughts of suicide. So again, we like to say at the center, it's the elephant in the room. Nobody's really talking about it. So we really want to encourage providers to do the screening at minimum, as a way to start that conversation. A lot of reasons why it's hard to get gambling screening done is, people aren't really familiar with gambling disorder. They don't recognize it as an addictive disorder. So if they screen positively, what are we going to do? Where is the help? What do we do next? Um, the research on gambling disorder is very limited. The National Council is actually pushing for the GRIT Act, which is Gambling Research, Intervention, and Treatment. They want more research done in the United States. A lot of the research comes from the United Kingdom or Australia. And then financial discussions can be difficult with clients. Gambling disorder is not a money problem, but having conversations about money can be a way to discover or find out if gambling is having an impact on their finances, on their ability to make ends meet, or because of that, causing problems at home. Um, again, it just can be a way. A lot of times I know at intake, we talk about, hey, we find out how much people make, but we don't know if that's sustaining them. And people might look at gambling as a way to make money, and, get themselves in a hole, right? So what was shared with you today through email is a screening guide. So this has 3 evidence-based screening tools that I kind of prefer, and I'll go over that. And then it also kind of talks about ways to integrate gambling screening and assessment into a full biopsychosocial. So the screening tools that I have in there are the Live Bet, which is a 2-question, brief biosocial gambling screen, which is 3. And so a yes to any of those questions prompts further screening. The Problem Gambling Severity Index is also in that booklet, and it is also used on our Help Seeker website, helpmygamblingproblem.org, as a self-assessment. So the Gambling Severity Index is a 9-question assessment tool, and it's used a Likert scale, like sometimes always type of questions. And so then it gives you a score at the end based on how you answer those questions. Gamblers Anonymous also has a 20-question self-assessment tool. So if people aren't really sure, you can always guide them to take a self-assessment. All of our materials or we're working towards getting most of our materials to include a QR code that will take persons directly to screening. So if you want to have those materials, they're free for you. So please reach out and we can get those ordered. You can also order them directly from our website. I also have the website here, which has the other screening tools, so you could download them individually if you like. And if there's any tools or any protocols or things that you want to talk about on how to integrate this beyond screening into your practice, please reach out. So again, we really want to, it's not really about discovering or finding people out, right? It's not about diagnosing. It's just really about having this conversation and letting people know, hey, this could be a concern. This could become, something. I worked with people in substance use, and I know a lot of times that money is burning a hole in their pocket and they don't want to spend it on drugs. So they might think that gambling is a safe way to spend their money and then find themselves having another problem. Again, we really just want to make it an ongoing topic of conversation, to have this conversation in group settings. We have our peers that can come out and give a gambling awareness presentation where they share their lived experience and kind of make that one-on-one connection with clients, maybe after the group, after they've heard that story. Um, and if we start the conversation integrated into regular practice, it can be a way of reducing stigma, right? It's universal. So, hey, everybody got that gambling screen. Did you get that gambling screen? Yeah, I got that gambling screen, because clients, we know they talk to each other. It can give permission and a safe space to talk about gambling. If we're asking the questions, yeah, we want to know how to have that conversation in a safe space if we find that somebody's having a trouble with it. We can make connections between gambling and other major life areas and start initiating change talk. Again, having that a part of your group practice, psychoeducation, and then repeating it, right? As maybe during treatment plan reviews, or maybe when just somebody brings it up. Hey, I'm playing the numbers. Oh, well, can I talk to you about that? Can we have a conversation about your gambling? Is that all right if we talk about that today? Again, always trying to ask for permission. People may not be ready to talk about their gambling. So when it comes to gambling in the workplace, um, there's some positives, right? It can seem like friendly competition. Hey, we're doing this work pool. Let's get all of our money together and see if we can win the Mega Millions, right? Um, It can give opportunity for employees maybe in different departments to interact with each other. If, everybody in the workplace, hey, I didn't know you were putting into this pool and all of that from different departments. But some of the negatives, if I refuse to put into the pool, I might be ridiculed or feel excluded, for not participating. Maybe now I'm more focused on when am I going to win or, when's that number come out than what I'm supposed to be doing at work. And then some bookmaking might be illegal and can expose employers to liability. So some of the warning signs when it comes to the workplace is maybe increased absences or lateness. Because they were out all night at the casino, again, maybe falling asleep at the table and uh, because there's no, especially in the casino, right? There's no clocks, there's no windows, they have smells and all kinds of technology to keep people in there and not looking at their clocks, not looking at their phone and finding out when it's time to leave. So there might be unaccounted for time. If persons are working with money, if they're in accounting or payroll or anything type of that, like you want to be aware of expenses. One of our first DVDs that the center put out is called Understanding Joy. And that's about a woman who embezzled from her employer and was incarcerated. And she was embezzling because of her gambling. And um, I'm also working with somebody that also had mismanagement of funds as well with their clients. Um, and facing disbarment because of that. Um, People with the gambling disorder are really a lot of, what do I want to say? Cognitive distortions, right? A lot of times, irrational beliefs. I'm going to take this money and I'm going to win it. So I'm going to be able to pay it back, right? And they find themselves unable to pay it back. Maybe requesting pay advances or loans. So if maybe a new hire is asking about an advance, that could be a red flag. Getting calls from creditors, or maybe getting those personal bills sent to work. So that way your spouse doesn't see all these new credit cards that are coming in. Again, borrowing money from coworkers, having that change in mood. It could be from, again, not only not just not being able to gamble or having that inability to kind of control the gambling behavior, but maybe when they have a big loss or thought that they were going to have a big win and it didn't turn out the way they thought, they might have some mood changes. Again, decreased productivity. If people are being distracted by those odds, and again, when they're going to gamble again, they're not going to be productive. And then missing money or saleable items that is missing. Could be some warning signs in the workplace that somebody is having some struggles with gambling. So when it comes to gambling in the workplace, some things to consider is that some form of gambling might be illegal. As I mentioned, there is some still ways to gamble mobily, or through apps and things like that that may not be completely legal. So you want to just, kind of check in with the laws of your state. Um, and then you want to define the type of gambling behavior that you might want to restrict. Um, right, participation in office pools for the lottery or sporting events. Is that something that you want to ban? Not, to not have persons engage in at all. But that also could include card games during lunch or persons playing for money. I know that's something I used to do with my colleagues, was just play gin rummy. It was not for money, but it was, something that we enjoyed doing during lunchtime. But this also gets brought up with residential providers. So providers that are working in residential settings, the clients want to do something for fun. In the meantime, downtime, and so they might be playing cards, but you want to find out, are they playing for money? Are they playing for cigarettes? Are they putting something on the line to make it more interesting? And then maybe trying to kind of explore that as well. What's the thrill about? And how that is related to other addictive disorders. Um, in the workplace, you want to consider policies, especially if there's large amounts of cash or where money changes hands. Um, Want to raise awareness about the warning signs by integrating some messaging in wellness programs. Let people know that there is help available. Um, Maybe some of like I said, we have some RAC cards that have like a high, low risk, signs of problematic gambling. We have one for gambling in the family. So you just want to maybe make people aware again that this could be a risky behavior that can put you in jeopardy um, of your well-being. And then to make that referral to EAP to get people help. So again, workplace policies, maybe making restrictions on, again, office pools or any type of gambling that might be done in the workplace. We want to make sure that EAP is gambling treatment capable so that people know, what are the warning signs? When is it at risk versus a disorder? Um, what are some ways that we can help people and get them connected to resources? So more awareness materials and educational trainings, and then financial counseling and resources that are available. Because again, it's not a money problem, but a lot of times persons in gambling recovery have to have some type of financial restitution as part of their recovery plan. So some resources for help and hope. So harm reduction, right? So this is a possibility if people are trying to gamble responsibly and reduce the harm is we want to make sure that they're not borrowing money to gamble and not gambling with any more than they can afford to lose. If they can't afford to lose $20 that month, then they shouldn't be gambling, right? I should save that $20 or put it towards their groceries or whatever it is that they can't afford. We really want people to look at gambling as a form of entertainment and not as a way to earn money. Um, so make a plan, right? Make sure you know how much you're willing to lose, and set limits on that. A lot of times, persons with problems with gambling are going back to that ATM. I got to get that $20 back that I just lost. So let me, you got to bet again. Maybe setting a timer on your phone. As I mentioned, there's no clocks, and particularly if you're betting in the casino. Set an alarm. Hey, if I only want to be in here for an hour, 2 hours, set that alarm and walk away. You want to understand the odds and that the house always has the edge. And consider teaming up with a friend so you can stick to your betting plan, especially if you want to leave on time. Um, and then promote exclusion programs. So, I think I have, yeah. And then also, so mobile bettors, I'll talk about that in a second about the exclusion programs, but mobile bettors, I don't know how well they advertise this, but within FanDuel and DraftKings and games like that, you can set deposit limits, you can set loss limits, wager limits, daily, weekly, or monthly amounts. So that way you're able to kind of self-restrict. Say, hey, I'm only going to lose this amount of money in a day, and you can set that within the mobile apps. So there is some exclusion technology. Gamban is something that you can download. It costs about, I think, $24 for the year, maybe 25. It's about $2 to $3 a month. And I believe you have to pay for it for the whole year, and it will actually not allow you to come off of it for that year. So it's a really great exclusionary tool for gambling websites and apps that are worldwide. BetBlocker is free, and it's a similar app to Gamban. If you're trying to block yourself from mobile betting, I would say download both, right? Excuse me. And then TrueLink, it offers financial solutions for persons with complex needs. So it was originally created for vulnerable adults or persons caring for their aging parents, or persons with disabilities, but it can also be used for people in recovery. So it's a banking card that you would attach to your bank, and your loved one, your support person can set limits on how much money you can take out in a day, where you can take it out, and things like that. So that way you're not able to just grab $50 from any grocery store. It's only this one that you can go to, for instance. It's a great tool if people are willing to kind of give that up. Again, gamblers need a lot of financial restitution as a part of their recovery. And sometimes, as a part of their recovery, they might be given an allowance. This is what you can spend during the day. This is your lunch money, and that's it. Because having that access to money um, might put people at risk. The voluntary exclusion program is something that is offered in Maryland through the Lottery and Gaming Control Commission, where people can voluntarily ban themselves from the casinos, lottery, bingo halls, and sports betting, which includes the in-person, online, and daily fantasy sports. So persons who actually exclude themselves from sports betting are also concurrently excluding themselves from 5 of the 6 casinos in Maryland because they also offer sports betting. And if you're caught or found within the casino after banning yourself, you can be charged with trespassing. And any monies that you have won or have, I'm not 100% sure, but any monies that you have won can be confiscated, and all those monies go to the Problem Gambling Fund. Once you sign up for this, it's a minimum of a 2-year ban, and you have to request removal from your list. So even though it's 2 years, it's not an automatic 2 years and then you're back. You can go back to the casino or back sports betting. No, you have to request removal from the Lottery and Gaming Control Commission. That's in accordance with the COMAR. So in partnership with the lottery, we connect those seeking to remove themselves to a dedicated and trained therapist. So those that are seeking to remove themselves have to have a one-time counseling session to review a workbook. And then at the end, the lottery and gaming actually makes that final decision about whether or not that person is able to go back to their wherever they excluded from. And then also Maryland offers no cost treatment. So if you or your family is struggling with gambling, it's no cost treatment is available regardless of the insurance or your ability to pay. So as I mentioned, we have over 100 providers that offer no cost treatment, and we do that through our partnership with the Behavioral Health Administration and the state's ASO, which is Optum Maryland, to reimburse providers for providing these therapeutic gambling services to Maryland individuals and their loved ones. If you're interested in becoming a provider, please reach out to me. Let me know. Again, as I mentioned, we have 5 peers that cover the state. We are hiring 2 new peers and probably breaking up the regions a little bit differently, but right now it's broken down by region. So we have Karen Miller, who covers the Western, Jim Nolan, who is Baltimore City, Will Hinman, who covers Southern Maryland, Ken Wolfson does Northeast Central Maryland, and Kenny Crawford does the Eastern Shore of Maryland. So if you are looking for a peer presentation, please reach out to one of them and they can share their lived experience with gambling addiction and recovery. Some of them have dual addiction, some of them have suicide as a part of their story. So it can be really dynamic and a great way to kind of just make that real world connection, to get them connected to other resources. Again, as I mentioned, some national resources, GAMBAN, BlackRocker, and TrueLink, the National Suicide Prevention Lifeline, as well as the National Council on Problem Gambling. So if there's a family member that you're concerned about that maybe lives in another state, this is a resource to find out what resources are available in that state. Gamblers Anonymous is a 12-step program for persons that have a desire not to gamble anymore. And Gam-Anon is for the loved ones, even employers of those that have a gambling disorder. You find out that you can't control it, you didn't cause it, and you can't cure it. That's the 3 C's of Gam-Anon, or any Anon program, actually. And then Spark Recovery. So for those that don't really want any type of spiritual aspect of their recovery, Smart Recovery is a more scientific way of getting sober. And then the Maryland resources that are available, the Center of Excellence has 2 dedicated websites. Our main website, mdproblemgambling.com, is geared towards providers and the community at large. It has a wealth of information, and please, if you can't find something, let me know. Helpmygamblingproblem.org is a little more directed towards the help seeker. So a little less cumbersome. Again, it has that self-assessment on there. You can also find a counselor to offer no-cost treatment as well. We also partner with the Maryland Coalition of Families. Nicole Ukeme is our peer for families. So especially with this launch of sports betting, we do have a lot of parents calling right now about their child, that they're really concerned about. And so we try to get them connected to MCF so that way they can get their own help and recognize ways to maybe become less enabling of the addictive behavior and help their loved one get help as well. There's also local GA meetings. DMVgamblinghelp.org is specific to the DMV area, so DC, Maryland, and Virginia. 211, which is, again, moving to 988, so we might have to eliminate this, but I believe Maryland will still offer 211. There's also legal aid, voluntary lawyer services. A lot of our clients, might be going through divorce because of their gambling, maybe have child custody issues. Consumer Credit Counseling Services of Maryland is another resource to help people get their credit back on track. And then the Cash Campaign of Maryland, so that stands for Creating Assets, Savings, and Hope, is a really great resource for financial assistance. They also partner and help persons that I believe their income limit is 60,000 a year. So anybody making that or under is eligible for free tax prep. And they'll actually do back taxes back up to 3 years. So if you're not paying your taxes, they can help you get that in order. They also have, I believe, financial counseling, and they also partner with an agency, I guess, where they offer a review of 22 public benefits. So again, if people are having trouble with their finances, maybe there's something that they qualify for that they weren't aware of, and there's a benefit out there for them. And Cash Campaign is a great resource to connect people to that. And so the way we can provide you support in integrating this into your conversation is that we provide free trainings with CEUs. We also offer case consultation calls 4 times a month over Zoom, free peer support that can provide, can connect with people one-on-one or provide group presentations if that's something that you offer. Again, free treatment is available for Maryland residents. If you want to become one of those providers, please reach out to me. But it's also, you can connect people to care through our website. Free awareness materials for your lobby or offices. We have rack cards, wallet cards, flyers, anything that you might need. We can help you so you can get the message out there. And the free confidential 24/7 helpline, 1-800-GAMBLER. But again, free, 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 free. And so just want to leave with maybe a few quotes. A wise man changes his mind, a fool never does. Any change, even a change for the better, is always accompanied by discomfort. And the great aim of education is not knowledge, but action. So really, I hope you've learned something today. But again, I hope you put some of this into action, start talking to people about their gambling, not to make judgments, right? But just to kind of see, is there an issue here? Is there some way that we can get you connected to help maybe arrest something before it becomes a problem? Um, Again, make this change, ask those questions. Again, I want to leave you with 1-800-GAMBLER. It's available through call, text, or chat 24/7. It's free and confidential. And please reach out to me if you have any more questions or if I can provide any help.
Thank you so much, Kristen. We do have a question in the chat. Jenna Westa asks, if we have a patient ask us to complete the paperwork towards removal and they are on referral from the center, do we have to complete it with them if we do not think they're in a healthy space to do so?
Eh, if they to complete if you don't feel so actually there is a space in that form, in that workbook, after you review the workbook with the client, there is some space for recommendations, and the lottery does take those recommendations into consideration. So if you feel the person maybe needs to go to X amount of GA meetings, or maybe needs more counseling, or maybe you just feel like they're not ready, you can make that recommendation to the lottery, and they do take that under consideration. I hope that answers the question.
And then I guess a question I had was, how often do you see substance use treatment centers also treating co-occurring gambling addiction?
So actually that is our primary way of connecting, particularly with like residential. So Hope House and Pyramid Walden are two residential providers, and as you know, they are primary substance use. Unfortunately, there is no gambling treatment only program in the state of Maryland. And from what I just recently reached out to Williamsville Wellness, which is a program in Virginia that has, I believe, 20 beds for gamblers. And they're also a substance use program. Again, it's a substance related and addictive disorder. So we want to make people aware that, addiction is addiction is addiction. Just because you're not putting something into your body doesn't mean that you don't have an addictive disorder. And again, looking at those similarities and differences, a lot of times, even people when are in residential treatment, if they use one substance, I use alcohol, this person uses opiates, we have nothing in common. You find that a lot of times, yes, you do. So a lot of our partners are with substance use programs. We are trying to, we do have some OMHCs on our list as well. Hope that answers your question, Alice.
And we have a few requests for the slides to be made available.
Okay. I think, did I send them to you in the PDF?
Not yet, but I will.
Okay, I will.
Okay, I'm opening up to if anyone else has any questions. All right.
Thank you all.
Well, thank you so much for your time today, Kristen. That was very informative. I feel like there's so much to do in that field in terms of expanding care and awareness. So thank you for being on the forefront of that. And thank you everyone for joining us today. We really appreciate it. And I hope you guys get a chance to enjoy the lovely weather.
Thank you.